Access, and as we continue to battle COVID-19, even more critical Americans have meaningful access to health care. And so that's what I'm about to do. And again, I'm not initiating any new law, any new aspect of the law. This is going back to what the situation was prior to the President's executive orders. And the first one I'm going to be signing here is the Strengthen Medicaid and the Affordable Care Act. And of all times that we need to reinstate access to, affordability of, and extent of access to Medicaid is now, in the middle of this COVID crisis. And the second order I'm signing relates to protecting women's health at home and abroad, and it reinstates the changes that were made, Title X and other things, making it harder for women to have access to affordable health care as it relates to reproductive rights. I'm sorry you had to stand in the cold.
Thank you,
Thank you all very much. We got a lot to do, and the first thing I got to do is get this COVID package passed.
Do we have Sean Sullivan standing by?
No one requires me to do anything.
And we've been watching President Biden sign several executive orders pertaining to health care. For more on all of this, let's bring in Sean Sullivan. He's a CBS News political contributor and White House reporter with The Washington Post. Hi, Sean. Great to see you. So break down for us what is in these executive orders on health care. As we know, we've seen the president sign a series of executive orders over the past several days, each one with a theme. Today's theme is health care. So what did he do today? By the way, I'd like to note that he made a point of saying, this is not any new legislation that I'm crafting. I'm simply reversing other executive orders that were signed by President Trump. I guess he's addressing some of the criticism that's been floated recently that perhaps the president is signing a few too many executive orders, correct?
Yeah, that's right, Tanya. I also found that very notable, the fact that he was underscoring that, because we're already seeing, as you mentioned, criticism a lot from Republicans that Biden, the president, in his earliest days here, is relying too much on the power of his office, the power of executive fiat. And of course, we have seen him on a number of different fronts, from climate change to the economy to battling COVID, sign these executive orders. It's almost becoming sort of a daily ritual at the White House. And today, in this latest set, we see sort of a couple of main things happening that President Biden is doing. One is he is opening the online marketplaces through the Affordable Care Act to allow people to buy insurance through these online marketplaces. Normally, these marketplaces would only be open for a limited period of time at the end of the year. But the message he is sending with this is, look, there are people who are out of work. There are people whose healthcare situation has been cast into flux during this pandemic, and they need healthcare, and they should be able to sign up if they need this. So from February 15th to May 15th, people are going to be able to, in many places, sign up for healthcare through these exchanges. And it's also notable that these are sort of two of the issues that he underscored when he ran for president: battling the pandemic and also bolstering the Affordable Care Act. It was something he campaigned on repeatedly in the primary and also in the general election. We're also seeing him move to revoke the so-called Mexico City policy. This is a policy that has divided Republicans and Democrats. We've seen the law sort of go back, the rule go back and forth. You know, we saw President Obama revoke this. We saw President Trump reinstate this. Now we're seeing Biden revoke this. This is a law. This is a rule that effectively bars foreign organizations from getting federal funding if they are using funding to promote or perform abortions. And so Biden is reversing that. That's something that abortion rights advocates are going to be cheering. But already we're seeing criticism from Republicans and from anti-abortion advocates of this move. We saw Mitch McConnell, the Republican leader, the minority leader in the Senate, criticize Biden for that. We also saw him, as we've seen other Republicans, criticize Biden for relying too heavily on executive orders. So this is a theme that is something to watch in the coming days as Biden continues to take these executive actions, Tanya.
Absolutely. And Sean, the president, who of course was vice president when Obamacare was enacted, did vow during his presidential campaign to protect and expand the 2010 health care law. So Sean, tell us, what is the current status of Obamacare? We know that it has been battered and maligned under the previous administration, but it is still standing, correct? What's the status?
It is still standing, and it has faced numerous legal challenges over the years from Republicans. This is part of the reason why this was such a big issue in the presidential campaign. And really, in the last couple of election cycles, we've seen Republicans and Democrats really do battle over this issue. You know, if you look over the years, this was something that at the very beginning, right after President Obama was able to pass this law, Republicans felt they could go on offense, that they could use this law to campaign against Democrats. And they were effective in a lot of cases. But as time has gone on, the law has become more popular. It has withstood all of these legal challenges that Republicans have waged against it. And now, with President Biden in office, you have somebody who is vowing not only to protect it, but to bolster it. And we're seeing him utilize that right now. So given the popularity of the law, you can understand some of the political incentive here for President Biden to do this. And again, also it gets to what he vowed to do during the campaign, which is to use the power of his office to battle the pandemic. And so that's why we're seeing this today. But again, we are seeing criticism of his actions from Republicans. And so it's worth watching in the coming days and weeks how that plays out, because this is a president who has vowed to be a unifier, somebody who's vowed to work with Republicans to foster bipartisanship. But we're already in the earliest days seeing some criticism from the other side. How does he respond to that? What does he do? Is he able to foster any, sort of working relationship with Capitol Hill when it comes to actually legislating? That's a big question right now as we see a lot of these executive orders go through.
Sean, and I want to touch on something a little bit further that you mentioned at the beginning, which was that the president also issued today a presidential memorandum unwinding the Mexico City policy. We're hearing a lot about it today, but, our viewers may not be as familiar. And we spoke with a representative from the UN earlier who works in international women's health. And she made the point, I think it's important to point out this isn't, a policy. He's now not enacted a policy that, allows the U.S. to willy-nilly fund international abortions. That's not what it does. But she said as part of women's reproductive health within the country, they follow very closely the guidelines of each individual country, but within the country and within the circumstances where that might be necessary, they help women, with safe and effective reproductive care. So I think that sometimes this Mexico City policy becomes very narrowly focused on one thing when it's really just a tiny piece of what, international women's health advocates are trying to get across.
Yeah, a lot of women's health advocates talk about this policy and have talked about it over the years. And they look at the Republican efforts to reinstate this, to implement this, and they've argued that that is an unnecessary and a position that bars a lot of these groups from helping women all over the world. And that's why we've seen this be a very sort of divisive issue politically, because the issue of abortion does come up a lot when this issue is debated. And it's something that I think will continue to stoke debate, just as we've seen throughout history. You see a Democratic administration, the Obama administration, rescind this. Then the very next administration reinstates it. Now another Democratic administration comes in and revokes it again. And so we've sort of seen the country go back and forth on this, and it has sort of become a divisive issue. It's notable that McConnell, as we talked about earlier, the majority leader, mentioning this on the Senate floor in a speech today. This is something that I think for the Republican base is meaningful to them. But this is an issue, as you point out, Tanya, that women's health advocates have pointed out is something that goes well beyond the scope of abortion. That in the political debate here in the United States, that has become the focal point of this rule when this has been debated and when we've seen administrations go back and forth on this.
Absolutely. Well, Sean Sullivan, thank you so much for joining us. We really appreciate your time. We're going to take a quick break now, but we've got a lot more news ahead. You are streaming CBSN, CBS News, always on.
These are hard, tiring, taxing jobs, even before coronavirus came.
This is my Clorox wipes, my Lysol. I have no idea what I'm walking into. I don't know if the customers are carriers.
I feel privileged to be out here when so many people are out of work.
Did you ever think that you would find yourselves at the front line?
We have the opportunity to bring something valuable to the community, and that feels good.
We have to be willing to change policy on a permanent basis to recognize and honor these workers.
It doesn't seem like it's worth the risk that you endure every day.
I have to do what I can to take care of myself and my family.
If you had the choice, would you stay home?
Maybe, yeah.
Truck is sinking.
Devastating flooding has reached catastrophic levels.
Rising sea levels are threatening America's coasts.
You would have to take that house and put it on stilts 10 feet tall. If the street is filled with salt water, what difference does it make how high you make your house?
The concentration of the highest rental rates is exactly where the elevation is highest.
This was the evidence to prove that climate gentrification was real.
Pay $1,800 in 5 days or you have to leave. Were you scared?
Yes.
Every single person who stood up and said, I am not paying this rent increase, received an eviction.
Haitians built this place and you're getting kicked out.
Yes.
The biggest names in politics.
Whoa, that's news. Do you think that the president has the authority to send in active duty troops?
Face the questions you want answered.
Did the CDC let the American people down? Tell me about the decision. When was it made? Who made it? What is the next area that you are concerned about? What does that mean for the risk of reinfection here in the United States?
You bring up a very good point, Margaret.
Margaret, that's a great question.
Face the Nation with Margaret Brennan on CBS.
Even really young kids are feeling what's going on right now. How should parents be talking to them about this whole question of racial justice?
How do we embrace this moment and turn it into real change?
What we really must focus on is moving from protesting to policy.
Engines at 65%, 3 engines running normally, 3 good fuel cells, 3 good APUs.
Roger, go ahead, drop up.
1 minute, 15 seconds. Velocity 2,900 feet per second. Altitude 9 nautical miles. Downrange distance 7 nautical miles.
That was a sad day for the country. 35 years ago, the American Space Shuttle Challenger exploded just 73 seconds after takeoff, killing all 7 crew members on board. The explosion is one of the worst disasters in the history of the U.S. space program. President Reagan delivered a somber speech from the Oval Office after that tragedy.
The families of the 7, we cannot bear, as you do, the full impact of this tragedy. But we feel the loss, and we're thinking about you so very much. Your loved ones were daring and brave, and they had that special grace, that special spirit that says, give me a challenge, and I'll meet it with joy. They had a hunger to explore the universe and discover its truths. They wished to serve, and they did. They served all of us.
President Reagan was supposed to deliver his State of the Union that night, but he delayed it. The Space Shuttle program was grounded for nearly 3 years after the accident. The Miami Heat basketball organization is enlisting the help of some furry friends to sniff out potential COVID-19 carriers. The American Airlines Arena is opening its doors to a limited number of Heat season ticket holders for Thursday's game against the Los Angeles Clippers. The coronavirus detection dogs will sniff all fans as they wait in line to enter the arena. If the dog sits next to a fan, the ticket is refunded and the ticket holder is barred from entering. Mike Larkin trains the dogs used at the arenas.
It takes time, takes repetition, you can imagine, for the dogs to get that process down. But once they do, then you have a fully operational dog that can do this type of work.
The use of COVID dogs is not proven to work all the time, but researchers say the results have been promising. The Heat front office assures fans dogs will not be the only COVID protocol in place. Those in attendance are required to remain 6 feet apart and wear a mask. There are several at-home coronavirus tests available now, but most have to be ordered online or bought in a store. Now, one company is offering testing kits to people in more convenient locations. CBS's Naomi Ruckham shows us where.
No more long lines or appointments for a COVID test. Soon they will be available in a vending machine.
Grocery stores, shopping malls, airports, and subway stations.
The company Wellness for Humanity unveiled the first machine in New York. Customers purchase the $119 test online and are sent a barcode which is scanned.
Simply place it in front of the vending machine.
Seconds later, the box pops out. Inside is a saliva test that can be done at home and shipped off to a lab. Once received, results take 1 or 2 days. They're advertised to be 99% accurate. The company plans to roll out 1,000 of the machines in locations across the country over the next 6 months. Other companies have similar vending machines that are used in Europe and Asia. The University of California in San Diego created one with free test kits exclusively for students who are required to get tested at least once a week.
Swab your nose, put it back there, and then 24 hours later, you have your answer.
People without a convenient vending machine can find at-home tests in stores and online, but results can take days. Companies like Illume are planning to offer kits that provide an answer in minutes. Customers take a nasal swab, which is read by a Bluetooth-connected analyzer and an app. It's expected to cost $30 and be in stores in the coming months. Wellness for Humanity is also developing a test with results in 15 minutes. It will eventually be available in the vending machines. Naomi Ruckham, CBS News, New York.
Second gentleman Doug Emhoff isn't just going into the history books. His title is also entering the dictionary. Merriam-Webster announced second gentleman as one of its 520 new words or definitions for 2021. Some entries are related to the COVID-19 pandemic, including convalescent plasma or long haulers. Others relate to social issues like decarceration and cancel culture. Then there's internet-based terms like a new definition for the @ symbol. Mr. Emhoff celebrated the news on Twitter this afternoon. He made reference to his title, tweeting, quote, "I might be the first, but I won't be the last." Senator Bernie Sanders has raised nearly $2 million off of his viral Inauguration Day outfit and says he's donating it all to charity. The memes and posts of the bundled up senator inspired him to add merchandise to his website. Demand was so high, the first item featuring the senator sold out within 30 minutes. The Vermont Independent says he is giving away all the funds generated from the merchandise to several causes in his state. A crochet doll of Senator Sanders is adding more to the charitable pot. Toby King created and sold this bundled up version of the senator for more than $20,000 on eBay Saturday. It took her 7 hours to make the 9-inch doll. King says it was perfect timing because she already had the pattern. The Texas resident also plans to donate her proceeds to charity. Coming up in our next hour, health care front and center. The Biden administration is facing an alarming new warning about the months ahead in the coronavirus pandemic. We will discuss the president's health care priorities. Vaccines in the classroom. New studies are focusing on the effect of COVID-19 vaccines on children, what scientists are hoping to learn from these trials. And emboldening extremism, why government officials say the Capitol riot on January 6th is encouraging the growth of domestic violent extremists. Those stories and much more when we return. You're streaming CBSN.
COVID has taken the lives of tens of thousands of Americans. Rural areas like this here on Navajo Nation are especially hit hard.
15 to 30% of our Navajo citizens don't have running water.
In any indigenous reservation, there is a shortage of physicians.
Native Americans are amongst the most vulnerable and hardest hit by COVID.
Yeah, the more we lose our elders to COVID-19, the more we lose our language and our way of life.
We need to bring awareness to the attention of Washington, D.C. and United States citizens that there is a need to focus on the first citizens of this country.
CBSN Los Angeles. Get local news, breaking news, anytime, anywhere.
It's easy to find us, and it's free.
Download the CBS News app on your favorite devices. CBSN Los Angeles, streaming 24/7. CBSN Pittsburgh, your neighborhood news, streaming 24/7. Anytime, anywhere. Find it on KDKA.com and on all your favorite devices.
In 60 years, we went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You're donating plasma to get by.
It's literally a slave wage.
I don't remember growing up like this. My mom didn't have to go to food banks.
It's pretty sad.
When breaking news happens in your neighborhood, there's now a place to go to see it as it unfolds. CBSN Pittsburgh.
Breaking this morning.
Anytime, anywhere. Find it on KDKA.com and on all your favorite devices.
Hello, everyone. I'm Tanya Rivero. Thank you for joining us. President Biden is focusing on health care today as the country remains hard hit by the coronavirus pandemic. Mr. Biden signed executive actions reversing anti-abortion rights policies. He also signed an executive order allowing HealthCare.gov to open for a special enrollment period. The president believes the move will undo the damage done by the past administration.
There's nothing new that we're doing here other than restoring the Affordable Care Act and restoring the Medicaid to the way it was before Trump became president, which by fiat he changed, made more inaccessible, more expensive, and more difficult for people to qualify for either of those two items.
For more on all of this, let's bring in Sean Sullivan. He's a CBS News political contributor and White House reporter with The Washington Post. Hi, Sean. Great to see you. So break down for us what is in these executive orders on health care. As we know, we've seen the president sign a series of executive orders over the past several days, each one with a theme. Today's theme is health care. So what did he do today? By the way, I'd like to note that he made a point of saying, this is not any new legislation that I'm crafting. I'm simply reversing other executive orders that were signed by President Trump. I guess he's addressing some of the criticism that's been floated recently that perhaps the president is signing a few too many executive orders, correct?
Yeah, that's right, Tanya. I also found that very notable, the fact that he was underscoring that, because we're already seeing, as you mentioned, criticism a lot from Republicans that Biden, the president, in his earliest days here, is relying too much on the power of his office, the power of executive fiat. And of course, we have seen him on a number of different fronts, from climate change to the economy to battling COVID, sign these executive orders. It's almost becoming sort of a daily ritual at the White House. And today, in this latest set, we see sort of a couple of main things happening that President Biden is doing. One is he is opening the online marketplaces through the Affordable Care Act to allow people to buy insurance through these online marketplaces. Normally, these marketplaces would only be open for a limited period of time at the end of the year. But the message he is sending with this is, look, there are people who are out of work. There are people whose healthcare situation has been cast into flux during this pandemic, and they need healthcare, and they should be able to sign up if they need this. So from February 15th to May 15th, people are going to be able to, in many places, sign up for healthcare through these exchanges. And it's also notable that these are sort of two of the issues that he underscored when he ran for president, battling the pandemic and also bolstering the Affordable Care Act. It was something he campaigned on repeatedly in the primary and also in the general election. We're also seeing him move to revoke the so-called Mexico City policy. This is a policy that has divided Republicans and Democrats. We've seen the law sort of go back, the rule go back and forth. You know, we saw President Obama revoke this. We saw President Trump reinstate this. Now we're seeing Biden revoke this. This is a law. This is a rule that effectively bars foreign organizations from getting federal funding if they are using funding to promote or perform abortions. And so Biden is reversing that. That's something that abortion rights advocates are going to be cheering. But already we're seeing criticism from Republicans and from anti-abortion advocates of this move. We saw Mitch McConnell, the Republican leader, the minority leader in the Senate, criticize Biden for that. We also saw him, as we've seen other Republicans, criticize Biden for relying too heavily on executive orders. So this is a theme that is something to watch in the coming days as Biden continues to take these executive actions, Tanya.
Absolutely. And Sean, the president, who of course was vice president when Obamacare was enacted, did vow during his presidential campaign to protect and expand the 2010 health care law. So, Sean, tell us, what is the current status of Obamacare? We know that it has been battered and maligned under the previous administration, but it is still standing, correct? What's the status?
It is still standing, and it has faced numerous legal challenges over the years from Republicans. This is part of the reason why this was such a big issue in the presidential campaign. And really, in the last couple of election cycles, we've seen Republicans and Democrats really do battle over this issue. You know, if you look over the years, this was something that at the very beginning, right after President Obama was able to pass this law, Republicans felt they could go on offense, that they could use this law to campaign against Democrats. And they were effective in a lot of cases. But as time has gone on, the law has become more popular. It has withstood all of these legal challenges that Republicans have waged against it. And now, with President Biden in office, you have somebody who is vowing not only to protect it, but to bolster it. And we're seeing him utilize that right now. So given the popularity of the law, you can understand some of the political incentive here for President Biden to do this. And again, also it gets to what he wanted to, what he vowed to do during the campaign, which is to use the power of his office to battle the pandemic. And so that's why we're seeing this today. But again, we are seeing criticism of his actions from Republicans. And so it's worth watching in the coming days and weeks how that plays out, because this is a president who has vowed to be a unifier, somebody who's vowed to work with Republicans to foster bipartisanship. But we're already in the earliest days seeing some criticism from the other side. How does he respond to that? What does he do? Is he able to foster any, sort of working relationship with Capitol Hill when it comes to actually legislating? That's a big question right now as we see a lot of these executive orders go through.
Sean, and I want to touch on something a little bit further that you mentioned at the beginning, which was that the president also issued today a presidential memorandum unwinding the Mexico City policy. We're hearing a lot about it today, but, our viewers may not be as familiar. And we spoke with a representative from the UN earlier who works in international women's health. And she made the point, I think it's important to point out this isn't, a policy. He's now not enacted a policy that, allows the U.S. to willy-nilly fund international abortions. That's not what it does. But she said as part of women's reproductive health within the country, they follow very closely the guidelines of each individual country, but within the country and within the circumstances where that might be necessary, they help women, with safe and effective reproductive care. So I think that sometimes this Mexico City policy becomes very narrowly focused on one thing when it's really just a tiny piece of what, international women's health advocates are trying to get across.
Yeah, a lot of women's health advocates talk about this policy and have talked about it over the years. And they look at the Republican efforts to reinstate this, to implement this, and they've argued that that is an unnecessary and a position that bars a lot of these groups from helping women all over the world. And that's why we've seen, this be a very sort of divisive issue politically, because the issue of abortion does come up a lot when this issue is debated. And it's something that I think will continue to stoke debate, just as we've seen throughout history. You see a Democratic administration, the Obama administration, rescind this. Then the very next administration reinstates it. Now another Democratic administration comes in and revokes it again. And so we've sort of seen the country go back and forth on this, and it has sort of become a divisive issue. It's notable that McConnell, as we talked about earlier, the majority leader, mentioning this on the Senate floor in a speech today. This is something that I think for the Republican base is meaningful to them. But this is an issue, as you point out, Tanya, that women's health advocates have pointed out is something that goes well beyond the scope of abortion. That in the political debate here in the United States, that has become the focal point of this rule when this has been debated and when we've seen administrations go back and forth on this.
Absolutely. Well, Sean Sullivan, thank you so much for joining us. We really appreciate your time. A new warning from the Department of Homeland Security says the U.S. is facing threats from violent, homegrown extremists. The agency says some of these extremists were directly influenced by what unfolded at the Capitol riots on January 6th. CBS News' Natalie Brand has our report.
The new alert from Homeland Security does not cite a specific credible plot, but it does warn more violence is possible against government buildings and elected officials. The bulletin describes a heightened threat environment from domestic violent extremists who may be emboldened by the successful breach of the U.S. Capitol on January 6th.
Those who are supporters of those insurrectionists saw the photos, saw the videos that was all over social media of them. The fact that they achieved that is an inspiration to those of their followers who aren't there.
The warning says groups are motivated by the 2020 election results, perceived grievances fueled by misinformation, and anger over COVID-19 restrictions, and says it's concerned those same motivations will remain through the early part of this year. In addition to growing uneasiness about their safety in Washington, some lawmakers are also expressing concern about potential violence when they go back home. CBS News has learned more than 30 House lawmakers sent a letter to House leaders saying they're targets and asked to use their office allowances to pay for additional personal security while they're in their home districts. USA! The letter comes as the federal riot investigation hits a new milestone with more than 400 open case files. Natalie Brand, CBS News, Washington.
We have some breaking news to bring you from South Carolina. State health officials confirmed 2 patients contracted a new variant that first emerged in South Africa. These are the first 2 cases of the variant in the U.S. Officials say the patients are not connected and neither patient has a recent travel history. Doctors in the state are asking people to continue wearing their masks and follow COVID protocols. Meanwhile, the CDC says schools are safe to reopen for in-person learning. But several school districts are hesitant to open their doors after nearly a year of online teaching due to COVID-19. 83,000 people have died in January, making it the deadliest month of the pandemic so far. The CDC is warning another 85,000 could die in the next 3 weeks. CBS News correspondent Meg Oliver spoke to several teachers who fear the rise in cases and a lack of sufficient COVID protocols to safely return to class.
The problems persist at vaccination sites nationwide. Long lines, cancellations, and supply shortages. And while President Biden has pledged to speed up the process, his administration's COVID response team is tempering expectations.
It will be months before everyone who wants a vaccine will be able to get one.
FEMA has requested up to 10,000 service members from the Defense Department to help staff as many as 100 vaccination sites nationwide. Part of the Biden administration's COVID response plan is focused on reopening schools, with the goal of getting a majority of K-8 schools safely open in his first 100 days.
100 days to get kids back in school is not quick enough. Schools closed is a national emergency.
Joseph Allen is the director of the Healthy Buildings program at the Harvard School of Public Health.
What's the biggest obstacle schools are facing implementing these guidelines?
Well, I think there's a lot of distrust and confusion from a scientific perspective. It's really quite clear. It really speaks a lot to how our country has deprioritized schools.
And a recent CDC study says there's little evidence for transmission in schools where precautions are met, like mandatory masks, physical distancing, and improved ventilation. But some teachers' unions say school systems do not have these COVID-19 precautions in place for a safe reopening. In Chicago, educators are threatening to strike if the district does not meet their safety demands.
My message to the teachers' unions is we need you guys. If you go on strike, our future is at stake more.
Chicago mom Tamika Hinton is a single parent to 10-year-old Destin. When in-person classes stopped, she cut her work hours to stay home and help her son with virtual learning. With her finances strained, the two of them moved in with her grandfather.
I've been hit really, really hard. I had to downsize a lot of different things.
How long can you maintain this?
Not long. Not long.
Joining me now is Dr. John Bradley. Dr. Bradley is the medical director of the Infectious Diseases Division and the Rady Children's Hospital in San Diego. Dr. Bradley, welcome. Thank you for joining us. As you know, there are already several vaccination trials underway for children, an age group not included in the earlier trials of the vaccine. What are scientists hoping to learn from these trials, and how long do you think it will be until there is a vaccine that is safe to administer to children?
So, as you pointed out, the vaccine trials are just getting underway in children. It is usual for the FDA to make sure that that drugs and vaccines are safe and effective in adults before exposing children. And with children, there's an additional issue that after infection, there's a syndrome called MIS-C. That's inflammation secondary to the virus. And we just want to make sure that the vaccines are studied appropriately in children so that we don't see an increase in MIS-C in immunized children. So I think the trials will be going quickly. There will be a lot of attention paid to both effectiveness as well as safety. So I don't expect that there'll be approval or authorization for vaccines for children until the end of the year.
You know, I'm always curious about trials involving children because, of course, they're minors and they need their parents' consent to participate in these trials. What concerns should a parent keep in mind if they are considering including their child in one of these trials?
Every child who goes into a trial will have a complete set of risks and benefits that are provided to the parent so that it's full disclosure. This is required by FDA, NIH, ethics boards, everyone. The benefit is that if a child's protected, that they won't be a source of infection to parents and grandparents, the elderly, people who are at risk in the family. The children themselves will not get such a benefit from the vaccine in terms of decreasing disease compared with adults, where there's huge value in preventing symptomatic disease. Kids, as you know, over half of them when they get infected have no symptoms at all. So it's more of a public health measure to make sure all kids are protected so that they don't spread it to those who are adults in the community who would be at great risk. And rubella immunizations in children are the same way. We immunize children to prevent pregnant women from getting rubella. So, so very important.
Good points. Very important to keep that in mind for sure. And Doctor, what do we know about the spread of COVID-19 in schools? You know, as you know, there's a big debate raging right now in the Chicago school system where, you know, teachers say we don't feel safe going back into the classroom. The government is saying we need you to go back into the classroom. So how can we make sure the school environment is safe enough that parents feel confident sending their children to school and teachers feel confident going back into the classroom?
That's a great question. And we know we can get kids back to school safely. We know what risk factors there are for spread. We know we can have kids with masks over a certain age. We can limit interactions between kids, both in the classroom and on the playground. The government and each state, especially California, has a plan for getting kids safely back to school. But everyone worries that there'll be an incident where a mask will come off and something will happen. So the teachers are understandably concerned. In California, and I'm sure many other states, as we go through the tiers of immunization, right now we're at 65 and above. The next tier includes teachers. So we're hoping not only to have safe schools so that kids won't spread it and bring it home, but we hope to have immunized teachers so teachers will feel more comfortable going back to the schools, which is really essential. They'll still need to wear masks and protective gear, but if you're immunized, you have this sense of calm that you're not at risk of getting something if you just turn your head for a moment and a child's coughing or sneezing. So both are important.
Yeah, it's so great to hear that that the state is prioritizing teachers, that they're next in line. That's so important. Speaking of California, your state, the governor just lifted coronavirus restrictions despite hospitals being so recently overwhelmed. Is there any concern that these hospitals might once again be quickly pushed to the brink before, having the chance to catch their breath?
That is a wonderful question. If people wear masks and do the distancing stuff that we've been asking for since the spring, then as they lift restrictions, there shouldn't be a spike in new cases and hospitalizations and ICU admissions. It's a big if. There's concern that as the lockdown is lifted, some people will think, well, the virus is gone and I can do anything I want now and stop wearing masks and distancing. So that's the fear. It's theoretical. We'll have to see. But there should be no reason that there would be an increased number of cases and hospitalizations if people follow regular guidelines.
And doctor, officials in the state are also worried about the spread of some of these new COVID-19 variants. What can you tell us about the variant that is spreading throughout California? Is it similar to the one that came from the UK?
Interestingly, there are many new variants that are coming up now, as you know, and California has our own variant. We're looking to see if there's increased contagiousness, increased virulence. So all of the studies that were done for the B117 that came out of the UK and are being done in the South African strain are now being done for our California strain, the 246. So, and there's actually evidence that there's yet another strain that's popping up in California. But as we look, we'll find more mutations, and that's been something that we've understood for a long time. But the critical thing is, will the vaccine continue to work? And for every one of these mutants, and the California one is being tested, the vaccine still protects you from infection. The vaccine may not protect you as much as for the original strains that were circulating, but everyone feels confident that there will be substantial protection from the vaccines.
That is good news, because as you point out, the vaccine, it's inevitable that it will mutate. So yes. As long as the vaccine can keep up, we're doing okay. All right, well, Dr. John Bradley, thank you so much for joining us. We appreciate it.
Thank you so much for having me.
Tracing the origin of COVID-19. Still to come, a team from the World Health Organization is on the ground in Wuhan, China. Why experts say it could be years, even decades, before they can prove the coronavirus started there. And a Pakistani court has ordered the release of the men convicted, then acquitted of killing American journalist Daniel Pearl. Now, Pearl's family is demanding justice in the United States. You're streaming CBSN.
This could be the worst that you've ever seen. Fires are going to get worse, and hurricanes are going to get worse, and they already are.
Firefighters struggle to contain over 600 wildfires.
Do not let go.
Thousands of people evacuated.
It's hard to find a place that has not been affected.
This is hurricane look. Behind me, you can see that we are in the eye wall.
Download the free CBS News app to watch.
Now getting some insight.
As our nation goes forward,
What do we expect Joe Biden to be doing?
Elaine Quijano goes beyond party lines,
Are there conversations happening about party leadership?
helping you make sense
What's the reality here behind the scenes?
There already is bipartisan consensus
of America's biggest political issues.
How many lives do we have to lose?
We need to keep pressing in the pursuit of a more perfect union.
So good to have your insight. Thank you.
Watch free with the CBS News app.
all the news that you need to know.
Trusted, true journalism.
Because the wind is so strong, there are no airdrops.
When did you start to feel that anxiety?
The best of CBS News. Streaming from anywhere the news is to everywhere you are.
Now they've had to expand to 3 hallways.
Morning news, served just the way you want it.
Here's a look at some of the stories that you may have missed while you were offline.
CBS and AM. Stream free weekdays on CBSN.
Russian opposition leader Alexei Navalny will remain in jail after losing an appeal to be released Thursday. The outspoken Putin critic has been in custody in Russia since returning to Moscow. Navalny was recovering from an assassination attempt in Germany. CBS News correspondent Charlie D'Agata has more.
Well, it may have been a foregone conclusion that Alexei Navalny's appeal for release would be rejected, but an animated Navalny came out swinging, complaining he hasn't seen his lawyers, calling his arrest a joke. Clearly, this was not just to the court, but to his followers and the international community. In the past couple of days, police in Moscow have raided the homes and detained his associates, including his brother, for organizing what they consider illegal protests. One of his supporters was even playing the piano as police raided her apartment. The call for mass protests last time, after his arrest last week, resulted in tens of thousands of demonstrators across the country demanding Navalny's release and generally protesting against President Putin, the government, and corruption. More protests were already planned for this weekend. As for Navalny, he'll remain in prison at least until his hearing on February 2nd. Tanya?
Charlie D'Agata, thank you. The Pakistani Supreme Court handed down a ruling Thursday to release all 4 men involved in the kidnapping and death of American journalist Daniel Pearl, including the man who had been convicted of beheading Pearl. Less than 6 months after the September 11th terrorist attacks, Pearl was a Wall Street journalist covering British terrorist Richard Reid, known as the Shoe Bomber. Pearl was kidnapped and executed in the Pakistani port city of Karachi, where his body was found in a shallow grave. His execution was part of a propaganda video, which was later sent to the U.S. consulate. For more, CBS News foreign correspondent Imtiaz Tayyab joins us from London. Hi, Imtiaz. So on what grounds did the Pakistani Supreme Court make this ruling?
Hey, Tanya, good to talk to you. Well, look, we're still waiting for Pakistan's Supreme Court to come back with a detailed explanation of their ruling. But we do have to remember that this all began back in April of last year when a lower court ruled that the men who had been convicted 19 years ago of killing Daniel Pearl should be released. Now, the key thing the lower court seemed to accept by the defense was, while the evidence was clear 19 years ago that these men were involved in the case, there wasn't enough evidence which proved that they themselves had killed Daniel Pearl. Now, as you were
We want to take you now to the White House, where Press Secretary Jen Psaki is holding the daily press briefing. Let's listen in.
Specifically, he directed agencies to re-examine rules and other policies that limit Americans' access to health care and consider additional actions to strengthen Medicaid and the Affordable Care Act so they can continue to provide access to life-saving care for millions of Americans. As a result, the Department of Health and Human Services will open HealthCare.gov for a special enrollment period from February 15th to May 15th. And just as a reminder, the prior administration only had it open for 6 weeks, so this is double that length of time. Starting February 15th, Americans without health insurance can go to healthcare.gov and sign up for health coverage, often at little or no cost. The president also rescinded the global gag rule, which bars international nonprofits that international funding. Let me state this again. Which bars international nonprofits that provide abortion counseling or referrals from receiving U.S. funding. And he directed the Department of Health and Human Services to take immediate action to consider whether to rescind regulations under its Title X family planning program. These also, of course, build on the actions the president has taken to put equity at the heart of his administration's response to COVID-19. Second, I wanted to update you on the amendment being made to the Public Readiness and Emergency Preparedness Act, or PrEP Act, declaration on the COVID-19 response. HHS will amend the current PrEP Act declaration to permit recently retired doctors and nurses to administer COVID-19 vaccines, and to permit anyone currently licensed to vaccinate within their home state and to administer shots across state lines. So we've talked a lot in here about the need for not just vaccines, but vaccinators, and this is an effort to put more vaccinators in the field. A number of states have already taken action to ease licensing requirements to expand the vaccinator workforce, but this nationwide action will make that easier across the board. The amendment will help us in our vaccination efforts with the continued goal of 100 million shots in 100 days. Also today, I just wanted to point you to, which you may have all seen, the statement by National Economic Council Director Brian Deese about the quarterly GDP and weekly unemployment claims. And finally, a note on the vice president's schedule. Today, she's doing local TV interviews and meeting with editorial boards in West Virginia and Arizona to discuss the American Rescue Plan. So with that, go ahead.
Thanks, Jen. I've got two, one foreign, one domestic. I wanted to ask you about the Pakistani Supreme Court's decision to release the man that was convicted of the killing of journalist Daniel Pearl. Does the White House have a response, and are there plans to ask for his extradition to the U.S. for a trial?
The United States is outraged by the Pakistani Supreme Court's decision to affirm the acquittals of those responsible for Wall Street Journal reporter Daniel Pearl's kidnapping and brutal murder, which shocked the world's conscience in 2002. This decision to exonerate and release Sheikh and the other suspects is an affront to terrorism victims everywhere, including in Pakistan. We recognize past Pakistani actions to try to hold Mr. Pearl's murderers accountable, and we do note that as of right now, Omar Sheikh remains in detention in Pakistan under national security authorities. But we call on the Pakistani government to expeditiously review its legal options, including allowing the United States to prosecute Sheikh for the brutal murder of an American citizen and journalist. And we're committed to securing justice for Daniel Pearl's family and holding terrorists anywhere accountable for their heinous crimes. And the State Department, I know, also just put out a statement.
I wanted to ask about this flurry of executive orders we've seen. President Biden ran on a pledge to restore unity. He promised on Inauguration Day he'd be a president for all Americans, but since he's gotten into office, he's been largely acting unilaterally. I mean, we saw a record-breaking number of executive orders. He has not yet met with lawmakers on Capitol Hill, and we're not even quite sure who he's talking to on Capitol Hill. So what do you say to Americans who are watching all of these executive orders? And does the White House think that this is the best way to make policy, considering an opposing president could come back in 4 years from now and erase all the work he's done with the stroke of a pen?
Well, there's a lot to unpack there, so let me try my best. First, the president put forward a large and bold COVID relief package, $1.9 trillion, that is meant to address the challenges the American people are facing and the dual crises that that the country is facing, from the pandemic to an economic recession as a result. That package has the support of the majority of Americans, according to every poll that we have seen publicly released. So I would say first that part of unifying the country is addressing the problems that the American people are facing and working to reach out to Democrats and Republicans to do exactly that. And that's exactly what he's doing. He's had calls with Democratic and Republican members of Congress, many of them. He's doing more calls today, but he's doing calls regularly throughout the week and has done them back to when he was inaugurated and even before then. But he's also calling Democratic and Republican mayors and governors to talk to them about what their needs are on the ground. So his objective as president is to deliver on what he promised in his inaugural address, govern for all of the American people by focusing focusing on addressing the issues that people are facing that aren't just hitting blue states or red states, aren't just hitting Democrats or Republicans, but are crises that we are all facing. And I think the polls will tell you that people are responding to that. In terms of executive actions, he also ran with a commitment to take steps immediately to address the pain and suffering that the American people were feeling. And that includes overturning some of the detrimental, harmful, and at times immoral policies and actions of the prior administration. But he's the first to tell you, as he said many times publicly, he's not going to take executive action alone. That's why he's put forward a number of packages that he's actively working with members of both parties to move forward on.
Follow-up, if the issue is that Congress is so broken that he needs to work quickly unilaterally to get some of this done, then does he support the move towards reconciliation that Senate Democrats are talking about right now? It's essentially the same idea.
Well, I didn't say that that was his point of view. Those are your words, not mine. I would say his view is actually that these policies, the policies in his COVID relief package, are policies that are not Democratic or Republican. Everybody wants their kids to go back to school. Everybody thinks that there should be more shots in the arms of Americans. Everybody thinks that the American people should get more relief and a bridge in this period of time that is such a challenge. So what he's saying is, here's my proposal. Here's how I think. Here's how economists, medical experts, health experts think we can address these crises we all agree are impacting all of our constituents across the country. Let's have a conversation about it. That's what he's doing. At the same time, he's not going to delay action that would help bring relief to the public and help bring access to affordable health care to the American people, help ensure women have access to reproductive health as well. So, there are a lot of steps he's taken over the past couple of weeks. He's not going to delay actions that require immediate action, that he can bring that relief immediately, but he's also going to work with Congress. He's proposed multiple bills to do that.
Go ahead. Following up on that, Democratic leaders on the Hill appear to already be eyeing reconciliation. We've heard Leader Chuck Schumer today saying that they're moving ahead with or without Republicans. Does this undermine your calls for bipartisanship, and are you urging them to give this more time?
Well, we're all very close to this here, reconciliation and all the terminology in Washington. Everybody who's watching may not be. Reconciliation is a parliamentary process. It's a way to get legislation through. It's a way to get relief to the American people. The president wants this to be a bipartisan package. Regardless of the mechanisms, Republicans can still vote for a package, even if it goes through with reconciliation. There's no blood oath anybody signs. They're able to support it regardless. And he wants this to be a bipartisan package. He's listening to Democrats and Republicans, we all are, to ensure that that's what it looks like at the end of the day.
But it doesn't seem that you can get both the speed you want and the bipartisanship at the same time. So which is the priority?
I don't think that's true. We refute that notion. These challenges that the American public are facing are urgent. People don't know how to plan to have food on their table now. They're worried about whether their kids can go back to school in a couple months now. They're worried about getting the vaccine now. And those are issues that Republican elected officials are hearing, Democratic elected officials are hearing from their constituents, and we're confident that people are going to listen to them and come together to support a bipartisan bill.
And just one other question on COVID. The South Africa variant is now been discovered to be here in the U.S. You, of course, have taken steps to ban non-U.S. citizens from South Africa from traveling here. That ban goes into effect on Saturday. Can you explain why Saturday? Why not sooner?
Well, the testing requirements we put in place that you noted were put in place for all departures, including South Africa. They take place. They will be put into effect at noon on January 26th. So this actually goes into effect Friday night, fair, to Saturday morning, close, and was put into place very quickly over the course of a week to stand up the necessary process. I mean, it takes a little bit of time to put these restrictions in place, to work with airlines, work with regulatory authorities to get them in place. We did that as quickly as possible, and before there was a reported case, of course, because we've seen the reports and we listened to health and medical experts. Go ahead, Caitlin.
So given that Democrats have kind of indicated they will move forward with or without Republican support, would President Biden sign a bill that only Democrats voted for?
Well, we're not quite there. That's getting us a few steps ahead of where we are now. He continues to believe that this should be, and will be a bipartisan bill that receives support from Democrats and Republicans. And he's having conversations with and listening to leaders and members of both parties to assure that we get to exactly that place.
But if we got to that place where only Democrats have voted for it, is he okay with that?
We'll have a conversation at that point. We're not there yet.
Okay, so second question on, given all the volatility surrounding Wall Street and GameStop, what is the Biden administration doing to protect the average American investor if there is going to be potentially a major market correction coming?
Well, the SEC put out a statement, I believe it was today, or in the last 24 hours, I should say. We'd refer you to that. We're not going to have additional comment from here.
Nothing beyond just monitoring it. Has he had any conversations with economic officials about what's going on?
We don't. He's briefed by his economic team frequently, but I don't have anything more to read out for you. Go ahead.
Is the SEC, DOJ, or broader administration specifically looking at Robinhood and other platforms' decision to prevent retail investors from purchasing certain stocks like GameStop?
I don't have anything more on this aside from to point you to the SEC statement.
Okay, just one more question. Is the administration working with Majority Leader Chuck Schumer to push Gary Gensler's nomination given the frenzy in the stock market?
Well, I've not spoken with our legislative team about Gary Gensler's nomination specifically, but certainly the president has spoken about the urgency of getting his team in place to address the range of issues we're facing, and I don't think that would be any different for Mr. Gensler. Go ahead, Sabrina.
Thank you so much. First on the COVID relief package, in order to cut a deal, would President Biden be willing to entertain a smaller package?
Well, first, and you didn't ask me this, but since there was some reporting this morning, I just want to take the opportunity to be crystal clear. We're not looking to split the package. That is not a proposal from the White House. I talked to the president about it this morning. That is not what our focus is or our intention is. And the reason is because we are not going to put ourselves in a place or anyone in a place where we're choosing between helping families to put food on the table and making sure kids get back to school, or making sure kids get back to school and getting a vaccine in the arms of Americans. Now, at the same time, what the president has conveyed to all of us and had during his conversations with members of Congress is that he's put his proposal out there. He was in the Senate for 36 years. He, of all people, appreciates the back and forth, the engagement, the opportunity to hear from members of all sides on what they like, what they don't like, things they think should be smaller. Some have proposed things should be bigger. There's, of course, lots of ideas. No member of Congress is a wallflower that are out there in public, and certainly that reflects the private conversations as well. And, you know, there are areas. For example, there has been some discussion of, can this be more targeted? You know, the president believes that, and that based on his recommendations of economists and his health and economic experts, this is a plan. This is a overall package and proposal that is absolutely targeted toward the people who need it most. But he's happy to have a conversation about that, and happy to have a conversation about any component that people are coming at him with good ideas. But our focus is on making it better, improving the package as people have good ideas. We're open for business and open to hear from members of Congress on that, but we're not going to do this in a piecemeal way or break apart a big package that's meant to address the crisis we're facing.
On COVID, can you confirm that the Biden administration is actively looking into expanding mandatory testing for domestic travelers here in the United States, and what other new domestic requirements can you detail that might be forthcoming?
Well, we had put out just a couple of days ago, as we talked about earlier, some specific requirements on international travel. As you know, I don't have anything to preview for you or predict on domestic travel restrictions. Our team is always evaluating and how to keep the American people safe. Go ahead.
Thanks, Jen. Can you give the American people any hope that the vaccine supply is going to go much over 10 million doses a week for the next couple of months?
Well, as you know, but in case people watching don't know, the president made an announcement just 2 days ago about increasing the supply of vaccines to ensure that we are getting as much of the supply into the hands of governors and elected officials as we can to get the vaccine into the arms of Americans. We're going to continue to push. As he said, he's going to continue to push. We will all continue to push. But the issue is not just vaccine supply. A big issue is vaccinators and the capacity to have people who can put the vaccine into the arms of Americans in communities and in neighborhoods to be able to do that. And it's also vaccine locations. So we already made an announcement less than 48 hours ago about increasing the vaccine supply going to states. He will continue to push. Our goal is, of course, to continue to increase in all of these areas.
But the main issue is supply, isn't it?
It's one of the issues. We will be in a place by this summer where we will have enough supply for the public, but that doesn't ensure that everybody will have had a vaccine, because we need to ensure we have the materials to distribute the vaccine, the vaccinators and qualified individuals to literally put the shots in the arms of Americans, places to do it. This is why this is such a Herculean task, because it requires so many components.
Sanofi just announced that it has struck a deal with Pfizer to produce 125 million doses of the Pfizer vaccine, but that's all going to the EU and it's not going to start until this summer. Has the White House been talking to domestic pharmaceutical companies about doing something similar more quickly?
Well, the president did invoke the Defense Production Act, as you all know, last week. But we're not, to quote Dr. Fauci, because it's always a good place to be, we're not producing shoes here. We're producing vaccines. And we want to work very closely with the manufacturers and the companies that are the experts on producing these to ensure they can do exactly that. It's not easy to start from scratch in a new facility. We're very mindful of that. And so right now, we're certainly reviewing all options, but our focus is on continuing to work directly with the manufacturers and their facilities to get the vaccines out the door. Go ahead.
Thanks, Jen. And Nandita from Reuters News. One question on the healthcare EO today. How many people does the White House expect will sign up during the supplemental time period? How many people are you expecting will sign up for these insurance programs through the Federal Exchange?
Well, we don't have a number to predict for you, but the reason that the president signed the executive order today was because it felt essential at a time of a pandemic when millions of people are concerned about their health care, far too many still don't have access, to open up an expanded window for Americans to be able to apply. And we will have a robust public campaign, paid media campaign to reach the American people, and we'll be putting a lot of levers and resources toward that. But I don't have a prediction for you in terms of the numbers.
So absolutely no estimates going in?
We're not going to do predictions from here. Just as many American people who don't have access and currently are not on the exchange that we can reach will be our goal to reach.
And I had a follow-up on the markets and everything that's happening with GameStop. You did mention, I believe, yesterday that the Treasury Secretary is monitoring the situation and she's kind of on top of it. There have been some kind of concerns about her previous engagements with Citadel and speaking fees that she has received from Citadel. Are there any plans to have her recuse herself from advising the president on GameStop and the whole Robinhood situation?
Well, just to be clear, what I said was that we have the Treasury Secretary is now confirmed. Obviously, we have a broad economic team. The SEC put out a statement yesterday that I referred to, but I don't think I have anything more for you on it other than to say, separate from the GameStop issue, the Secretary of Treasury is one of the world-renowned experts on markets, on the economy. It shouldn't be a surprise to anyone she was paid to give her perspective and advice before she came into office. Go ahead. Before she came in to be the Treasury Secretary, I should say. Go ahead.
Jen, I have a couple of foreign policy issues.
Sure.
The first one is on Taiwan. Chinese Defense Ministry spokesman said yesterday that the Chinese military activities in the Taiwan Strait is a necessary response to foreign intervention and that any efforts towards independence means war. Does the administration believe that Beijing is testing the U.S. on the issue of Taiwan, and how would you respond?
Well, the good news is that my longtime friend John Kirby is giving a briefing today at the Department of Defense, and I would certainly refer you to him and any comments he makes on this specific issue. Do you have another question?
Yes. I'm just, again, following up Secretary Blinken's statement yesterday on the review of the sale of F-35s to the United Arab Emirates and also missiles to the Saudis. What is the message of the administration to the region in terms of your position on the Abraham Accords? I understand the president is open to having more countries join, but how urgent is it for the administration, and what would be your strategy? Would you, for example, continue the carrot and sticks approach of the Trump administration?
Well, I know Secretary Blinken was just confirmed yesterday. I love having all these cabinet members and colleagues in places and agencies because there's even more expertise out there. But as you know, we've recently paused some arms sales to ensure they meet our strategic objectives, including how to end the conflict in Yemen. But State will be able to speak to it in greater detail. And as you also noted, there's going to be an ongoing review of a range of policies, including what our engagement will be in the Abraham Accords.
In terms of the urgency, how urgent is it for the administration that more countries sign on?
Well, again, this will be under the purview of the State Department. I'm sure they'll be speaking to it, and the Secretary was just confirmed earlier this week, so we'll give him a minute to figure out where his pencils and pens are, but certainly it's important, an important issue and one that they will be reviewing soon, I'm sure.
I have one more question on Russia. Do you have anything else to add? Now that the Russian court has rejected the appeal of Alexei Navalny, anything else that you'd like to add beyond what you've said?
No, as I noted the other day, and as was clear in the readout that we issued of the president's call with President Putin, he did not hold back in conveying his concern and about the treatment of Alexei Navalny and the treatment of protesters, and that is certainly something that will continue to communicate at many levels with the Russians. Go ahead.
Hi, two questions. Actually, third, I just wanted to follow up on the Russia question. Is there anything at all that you can give us in terms of the tone of that call or the length of the call? I mean, the topics that you laid out, kind of boom, 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 were all pretty, it seemed like quite a difficult conversation for the Russian president, perhaps. I'm just wondering if you can give us any sort of sense of color about how it went.
Well, I'm not in the business of reading out anything the Russians are doing, as I know you're not exactly asking, but sort of. I will say that President Biden had clear objectives that he wanted to get across during that call. He has never held back as it relates to President Putin or his concerns about the actions of the Russian government, and he certainly conveyed that clearly during the call. As you know, there's also a review that's underway about a range of activities that is being overseen by his national security team, and he touched on a number of those issues during that call. But I don't have anything more for you. I'm sure the Kremlin is happy to give you a readout of how well President Putin thinks the call went. Go ahead.
Fair enough. Another question is just on immigration. A federal judge in Texas has blocked your 100-day deportation pause. I just wanted to see how that's impacting the Biden agenda and if that is any way a reason for perhaps a delay in an immigration EO that we've been expecting.
No, I will say I know we had a statement on the specific case you referenced, which I'm happy to circle back with you on it if you haven't received it. In terms of our overarching agenda and approach to immigration, there was an early and draft version of what our executive order plan and schedule looked like, and that was early and was draft and was not accurate. But I will tell you, get some sleep this weekend. We'll have more to say next week on immigration. The president will, so we'll have more to report out to you in the next couple days.
Just one final thing here. I was curious, some of my colleagues have earlier been asking you about reconciliation and sort of the tension between moving quickly with Biden's legislative agenda versus sort of a longer period of negotiation. And I do wonder with this last week, you did have Senator Leahy in the hospital, Senator Mark Warner in quarantine because of COVID. There's a pandemic going on, and you have the slimmest possible majority in the Senate. Is there any sort of, when you look at the health situation, is there any sense that perhaps, moving it along quickly while you still have a majority might be the better move?
Well, I've watched Senator Leahy in action for quite some time, and he has been, continues to be an advocate, as we know, for justice, for equality, and he's pretty wily and fierce. So we're pretty confident we're going to be working with him for a while. And as you know, he's resting at home, and we wish him our best. But I would say the president came into office knowing he was going to have a slim majority. And that it would be essential to work with both Democrats and Republicans, and that it would be extremely challenging, if not nearly impossible, to get big, bold work done on behalf of the American people without working with both parties. And that's exactly why he has himself had a number of engagements and calls with members of Congress, Democrats and Republicans, and why he has asked his team to do exactly that as well. So we've known, of course, even before the election in Georgia, we thought there wouldn't even be a slim majority. We would be in the minority. So, he's been planning for that, and we've been planning for that through the course of the last several months. Go ahead.
I'm following up on immigration. I understand what you're saying about the document that's out there with some executive orders and dates, but the chief of staff also indicated that immigration would be coming by February 1st, which I believe is Monday. Mm-hmm. So are the immigration executive orders coming on Monday? And is there some desire to wait until the secretary is confirmed for the executive orders, or can you give us shed some more light on this?
No, I would say, as you guys may know from doing your own planning with long-term enterprise stories, sometimes things change. And things change in communications planning and what day you're going to put information out. And there's a range of reasons for that. But I would say stay tuned. We'll have more to say next week.
So you won't say if it's Monday or not? Just sometime next week?
It will be next week.
Okay. And one of the executive orders that we're talking about, a plan for family reunification at the border. I mean, that's one. Obviously, there's many, but that's one that a lot of people are waiting to kind of hear what that plan is. Is that something we should expect?
Well, the president talked about his commitment to putting together a commission for reunifying families. He remains committed to that, and we'll have more to share on that soon. Go ahead, all the way in the back.
Thank you so much, Jen. Raquel Carrembu from TV Globo Brazil. I have two questions. Going back to the climate crisis, during the campaign, President Biden warned of economic consequences if Brazil did not reduce deforestation on the Amazon. I'm wondering what kind of consequences he's considering, if it could hurt, for example, the trade negotiations with Brazil or the OECD support.
Well, we just announced yesterday that we're going to be doing a climate summit coming up in the next couple of months. And of course, this is a big priority for President Biden. And that's why he asked his good friend, former Secretary Kerry, to lead our climate international effort. And certainly Brazil will be a key partner in that. But in terms of what those negotiations and discussions look like, it's a little too early for that at this point. And I'd certainly send you to the State Department and Secretary Kerry's office for more details.
Okay, so just a follow-up. Did he invite the Brazilian president? Will he invite for the summit? And is also President Biden still planning to label countries as climate outlaws? And if so, would Brazil be part of this list?
Well, we're not quite there yet, given we just announced it. There haven't been invites or anything that went out, but we're happy to keep everybody updated. And certainly, as the United States is a large emitter, so is Brazil, so is China, so are many large countries and large economies, and we all have a role to play in addressing this crisis.
One more question, Jen. When does President Biden think he will be able to start doing, or he will do his first international trip? And where would be the first place he would go?
I don't have anything to preview or predict for you at this point. As you know, we haven't done any domestic travel yet, given COVID, so I certainly don't have any predictions about a foreign trip. Go ahead, Sabrina.
Sure. I had a question. At her confirmation hearing yesterday, UN Ambassador Designate Linda Thomas-Greenfield said she believed that BDS, the boycott, divestment, sanctions movement to pressure Israel, is unacceptable and verges on anti-Semitism. Is that a characterization that the White House shares when it comes to the BDS movement?
I don't have anything more for you on kind of our position. It's, I think, been that the president has spoken to this as a candidate and prior as vice president, but I don't have anything new, and I'm happy to get back to you if there's anything I can get to you from the National Security Team. Go ahead.
Thank you. Rob Curley with the Washington Examiner. Just to actually follow up on that, Linda Thomas-Greenfield also said she would be standing against the unfair targeting of Israel, the relentless resolutions that are proposed against Israel unfairly. Is that the position of the White House? I mean, Israel, after all, is in violation of international law, illegally occupies the West Bank and Gaza. Do you believe it's unfairly targeted?
You know, I didn't see her full hearing yesterday. Actually, I didn't see any of her hearing. I'm happy to review it and take a look and see if there's more we can speak to from our end.
Can I also just bring back to the executive orders, the questions we were discussing at the start? So I'm still trying to sort of reconcile this deluge. What are we at? I think we're at 26 executive orders now, and reconcile that with the campaign rhetoric, because in October, Joe Biden said there were limitations on the use of executive actions, things you can't do by executive order unless you're a dictator. We're a democracy, we need consensus. I think you said earlier that some of these executive orders were being used to roll back some of the immoral things that the previous administration had done. If you're calling these things immoral, is that seeking consensus and unity? And then also, I mean, does it suggest that President Biden sees himself as perhaps a benevolent dictator?
Well, Rob, I'm sure this wasn't your intention, but I think you took the president's comments a bit out of context. He was asked about tax reform and whether that could be done via executive order during the interview with George Stephanopoulos, which you're referring to.
But I think
I think the question is pretty important context for everybody, and he said no. And the president also said during an interview with columnists back in December that he didn't think executive action should be used for everything, and that certainly is his point of view. But there are steps, including overturning some of the harmful, detrimental, and yes, immoral actions of the prior administration that he felt he could not wait to overturn, and that's exactly what he did. Now, any historian will tell you that he walked into the presidency at one of the most difficult moments in history that required additional executive action in order to get immediate relief to the American people. But he believes, as is law, as everybody knows how a bill becomes a law, is that in order to make action and policy permanent, you need to work with Congress. That's why he has also proposed a COVID relief package, a big, bold package. Some say very big. I agree with that. And also an immigration bill. He has not held back or delayed putting forward legislation either. So he's going to use the levers that every president in history has used, executive actions. But he also feels it's important to work with Congress and not just one party, but both parties to get things done. Go ahead in the back.
Thank you, Jen. A couple of questions. One technical question on the EO signed today. Does the EO on ACA open the marketplace to non-citizens, to legal residents or undocumented immigrants that may be able to benefit from the extra care?
It doesn't change the requirements for qualifying for the Affordable Care Act. It opens it up for 3 months for people who would be already eligible for the Affordable Care Act. So, but obviously there are, the Health and Human Services team will continue to look for ways to expand access. I will say, you didn't ask this, but this is a common question, so I'm just going to proactively answer it, that we do feel as an administration that ensuring that all people in the United States, undocumented immigrants as well, of course, should receive access to a vaccine because that, one, is morally right, but also ensures that people in the country are also safe.
And that was my second question. How are you guiding the states?
Good.
Actually, yes.
Okay.
How are you guiding the states?
It's a common one.
Yeah, how are you guiding the states, if in any way, to get those undocumented communities to come forward to get vaccinated? Many of them in the states don't have any way to prove that they're residents of those states in order to go to their local clinics and prove residency to get the vaccine. So how are you working with the states to get that done?
It's challenging. We've talked about this a bit in here. I mean, there's obviously vaccine hesitancy, which certainly exists in communities of undocumented immigrants, and the concern of what it will mean for their status. But we are focused on ensuring we get the vaccine out broadly and to communities across the country, because that will make the American people safer. And it's something we have to be both creative about, aggressive about, ambitious about. It's one of the reasons we need additional funding through the American Rescue rescue plan, but also one of the reasons why we plan to have an aggressive public education campaign to help embolden and empower local doctors and authorities.
And if I may ask one more on Cuba, do you guys plan on walking back all of those restrictions that were put into place under the Trump administration after the Obama administration had opened things up with Cuba?
Well, our Cuba policy is governed by two principles. First, support for democracy and human rights. That will be at the core of our efforts. Second is Americans, especially Cuban Americans, are the best ambassadors for freedom in Cuba. So we'll review the Trump administration policies, as we are in a number of other areas of national security, with an eye to ensuring that our approach is aligned with that. But we will take our own path. I don't have anything to predict for you at this point in time. Go ahead, Alex.
I wanted to clarify something. We talked a little bit about the administration's stance on school reopenings yesterday.
Sure. I wasn't really clear on that, so I got a little better information.
Navalny indicated that he believes, or the administration believes, that schools need more funding for them to be safe enough to reopen for students to go back. But there's been a number of studies, including the recent one out of the CDC, that have shown evidence that schools are perfectly safe for students to go back, and there were recommendations that they should go back. So this seems like a bit of a dispute between teachers' unions and sort of data and the science. So where does the administration stand in that dispute?
Well, first, let me be absolutely clear. President Biden wants schools to open, and he wants them to stay open because it's obviously very disruptive for families. I'm a mother, for anyone who has kids, for kids to come in and out of school. But that means making sure, as you said, that every school is able to have the equipment and resources to open safely, not just rural schools or private schools, which often is where a lot of the school reopenings and schools staying open is happening. It's more of a challenge in public schools where they don't have that funding from tuition or smaller populations where it's easier to put in place the actions needed to keep the schools open. But the CDC study, which I know has received a lot of attention, was based on kind of an area that was more rural in Wisconsin. It was not, and I think what Dr. Walensky has said is that, and I think she said this on CNN last night, is that for areas where they are more populated, where schools where there's a lot more foot traffic, that there are going to need to be a lot of steps put in place in order to make the schools reopening safe. But we are committed to doing that. That's why the president signed an executive order last week supporting the safe reopening of schools. It requires the Departments of Education and CDC to provide evidence-based guidance. So that will include things like testing, smaller class sizes, more ventilation, better cleaning, PPE, strong state and local public health guidance. But we want to provide that clarity from the federal government because there's a lot of confusion, and public schools especially don't know what steps they need to take, how to ensure they're safe. Those are all good decisions that are going to be made locally, but we want to give them the guidance. That's in process. Our team is working on that. Dr. Walensky, the CDC, and our health experts, and we hope to have more specifics soon.
Maybe two more questions.
Go ahead.
So American savings rate has been up throughout the pandemic. And so I'm wondering why give all Americans a $1,400 check and why not means test for the relief that your administration is talking about?
Well, first, the proposed checks, I mean, have the same criteria as the package that received broad bipartisan support in December, right? So approximately the $1,400 checks would go to families making approximately $150,000 a year. There's a scaling up, as I think you're referencing, up to about $300,000. I think you all are aware of this, but just for everybody else. And, there has been some questions about that. President Biden, our economic team, we're open to discussing that. But we want to ensure that the families that need relief, that need assistance, get it. And I would say at a time where we saw the economic data today, and this was reflected in Brian Deese's statement, it was worse than any week, I don't want to misquote myself here, than that we saw during the Great Recession. I mean, people are suffering. Millions of people are out of work. People don't know how to put food on the table. These challenges are real. The data shows it, but we also see long lines for food pantries. We see, people who are out of work and don't know what they're going to do to make ends meet. And so that's tangible, that's real, and we want the package is going to need to be big and bold to address that.
And then since we've been talking about women's health and access to abortion today, does the administration plan to suspend the requirement that the medication abortion pill be picked up in person? I know that that's something that advocates candidates have been pushing for after the reversal under the Trump administration.
Yeah, I've certainly seen some reporting and questions about that. I'll have to talk to our health team about that specifically.
Can I ask one more about the travel restrictions?
Sure, go ahead, and Caitlin, then we'll go to you.
A lot of our viewers are asking if there will be any kind of consideration for waivers for students or unmarried couple like fiancés, since that is now the requirement for testing and quarantine.
Well, I know there's been a lot of coverage of this and questions because these are people's lives and human beings who are missing their loved ones and their family members. And just to restate what the requirements are now. So spouses of American citizens and lawful permanent residents are able to travel under these restrictions we've put in place on international travel, although they have to take part in the mandatory pre-departure testing that applies to everyone. And we are reviewing and assessing, I should say, how students and unmarried couples and how we can proceed with that moving forward. I don't have anything to preview for you, but our team is looking into that.
What is the criteria? Why countries with high numbers like Russia or India or Mexico are not in the list?
Well, our health and medical team takes a close look at what restrictions we need to put in place in order to keep the American people safe, and that's how we review it. It's not about geopolitics. It was at times in the prior administration. That's not how we approach things. It's about where we need to put restrictions in place to keep the American people safe. I promise, Caitlin, you get the next question.
So just to get some clarification on the CDC study about schools being good to reopen if precautions are taken, is the White House position that it needs to be further studied since you're citing just the one school in Wisconsin, or does the White House agree with the recommendations from the CDC about schools reopening?
Well, the CDC hasn't issued the formal recommendations or requirements on how all schools across the country can open. They did a report, as they do reports frequently, based on an area in Wisconsin. Important, interesting data, no doubt, but that is not reflective of every school district and community in the country. And so they will be coming out with more specific requirements, or more specific, I should say, guidelines for the public, because there are schools that are in much more highly populated areas. There are schools that have far more kids in classrooms, far more kids walking into the school, and they want to ensure that there's clarity on testing needs, class size needs, public health guidance that people can abide by. But their recommendation is that K through 12 schools should be the last settings to close after all of these mitigation measures have been employed and the first to reopen. So we all want schools to open and be open for good. What I'm reflecting on, or what I'm trying to clarify, I guess, is that schools in cities are dealing with different challenges than schools in rural communities, and schools in Wisconsin may be dealing in different challenges than schools in downtown Atlanta, right? So there needs to be the CDC will issue more specific guidelines soon. They're focused on it now.
Okay, and last question on this. So President Biden has said he wants all schools to reopen in his first 100 days. Is that still the goal if Congress does not pass this proposal, which has the money for schools, which Ron Klain and others have said is what they believe schools need to reopen?
I sense skepticism about the bill getting passed. We don't feel that. Look, I think the reason... I know, that's your job. Look, I think, Caitlin, one of the reasons why we're so focused on the American Rescue Plan and getting it urgently passed through Congress is because we need this funding in order for schools to reopen and for them to have the support to ensure that they have proper ventilation, better cleaning, testing, PPE. That's a key component of the package. And that's one of the reasons we're not going to negotiate out that versus vaccine funding or unemployment insurance, because that's a key component. And we need that to ensure that schools will have the resources across the country to be able to reopen. And that's exactly what the president wants to happen.
Thank you, Jen.
Thank you. Oh, okay, we're good. She was very patient. Go ahead.
Thank you. I just wonder if there is a general sense of frustration just about the pace of things, given the vaccine distribution, some of what you inherited from the Trump administration, trying to roll out executive orders, working with Congress and sort of having some lawmakers raise concerns. Is it harder to change things than you all thought it would be?
I'm only laughing because we're on our 8th day here. So, and in that period of time, the president has signed multiple executive orders. He has proposed several comprehensive bills. He's had many conversations with members of Congress about the urgency of getting things done. And I will say, in those conversations, there is an understanding and agreement about the urgency of addressing these issues. So, no, we're actually pretty hopeful and optimistic about the opportunity and the ability to work with Democrats and Republicans to get packages through to help bring relief to the American public. But we also recognize that members of Congress have, they're not wallflowers. They have different points of view. They have lots of ideas. They're going to bring those forward. We're hearing them, and we're just eager to move things forward as quickly as we can. But we're on day 8, so we are confident we're still on a pretty rapid pace here. Thanks, everyone. I appreciate all of you. I'll be in my office. Thanks for your time, and we'll do this again tomorrow.
And we've been listening to White House Press Secretary Jen Psaki hold a daily press briefing. She went over the president's executive orders regarding health care that he signed today and took questions on a variety of issues, saying the U.S. is outraged at the acquittal of the man in Pakistan who had been convicted of participating in journalist Daniel Pearl's murder. Psaki also defended the number of executive actions the president has signed, saying he ran on providing immediate relief to Americans and is living up to that promise. She fielded many questions about the speed of the vaccine rollout. She was also asked about efforts to monitor the financial markets in light of the GameStop stock surprise. We're going to take a quick break now, but we've got a lot more news ahead, so stay with us. You're streaming CBSN, CBS News, always on.
The biggest names in politics.
Whoa, that's news. Do you think that the president has the authority to send in active duty troops?
Face the questions you want answered.
Did the CDC let the American people down? Tell me about the decision. When was it made? Who made it? What is the next area that you are concerned about? What does that mean for the risk of reinfection here in the United States?
You bring up a very good point, Margaret.
Margaret, that's a great question. Face the Nation with Margaret Brennan on CBS.
Go to the ends of the earth.
Right now.
We got something crazy.